Good day everyone. I am Raven A. Venezuela, your pretty moderator for today's video presentation. I am tasked to introduce to you our topic as well as in introducing my groupmates who are assigned to discuss the important lessons under Module 3 Drug Education. Module 3 Drug Education tackles on what is drug, how are drugs being administered in the user's body, how does a drug affect the user's mentality and physical health. So, at the end of the lessons, learners will be able to identify the two forms of drugs, know the meaning of self-medication and its possible result to the users, and learn the different ways in the administration of drugs. So, for our lesson 3.1 entitled The Nature of Drugs, may I introduce to you our first reporter, the ever-gorgeous gem of Harolete, Miss Marjorie Artoza. She will be discussing what is drugs, forms of drugs, importance of drugs, and differentiate the prescriptive drugs and over-the-counter drugs.
Good day everyone, I am the first reporter, and to begin the discussion I am going to define first what is drug. So it says here that a drug is a chemical substance that affects the function of living cells and alters body or mind processes when taken into the body or applied through the skin. In medicine, it is used to diagnose, cure, prevent the occurrences of a disease or disorders, and prolong the life of patients with incurable conditions. So, a drug is any substance other than food that used or help to prevent, diagnose, treat, and relieve symptoms of a disease or any condition. So, it also affects how our brains and body works. So, intaking drugs may also cause the changes of our moods, behavior, feelings, our thoughts, and the alertness. So, this includes the prescription medicines, the OTC drugs or the over-the-counter drugs, alcohol, tobacco, and of course the illegal drugs. So we have two forms of drugs, the natural drugs and the synthetic drugs. So when we say natural drugs, these are drugs that are commonly found in our nature. So from the word itself, natural, it is organic, and most of the time it came from plants. So what makes a drug natural is when it haven't done or undergone any processes. So the next form of drug, which is the synthetic drug, these are drugs that are produced by clandestine laboratories, which include those drugs that are controlled by law because they are used in medical practice. So synthetic drug are drugs, although they came from organic or natural substances, mayayakan natin yung synthetic because it undergone a scientific processes na. So some are used in medical practices and some are became illicit drugs. So some examples, we have cocaine, heroin, and ecstasy. So the difference between natural and synthetic drug is based on how they are made before distributed for consumption. So when a natural drug is mixed with synthetic substances, it is no longer considered as natural or organic. So, drug helps the human body and mind to function better during an illness. Pero there are instances na ginagamit hiya incorrectly without knowing the possible consequences or the possible effects in our body. So, because of this, may dakita mga prescription medicine. So these medicine are only purchased in pharmacy with the doctor's prescription or the written authorization coming from a doctor. So only a medical doctor can prescribe such drugs. So these prescriptive medicines are dangerous in our health kung gini-intake hiya incorrectly. So this causes or it might causes our body or our illness worse destroy our blood cells, damage the body, and even cause deaths. So the practice of taking drugs without a proper medical supervision is called a non-medical use or the drug abuse. Prescriptive drugs. These are drugs requiring a written authorization from a doctor to allow a purchase. So they are called pharmaceutical or controlled drugs. So kinahanglan prescription from a doctor para ka makapalhini nga types of drugs because we have different types of body, so it depends also in our age, weight, height, tapos the dosage that our body nga kaya intake. So prescriptive drugs are regulated by the FDA and is purchased only in pharmacy. So when can we say that a prescription medicine are being misused or abused? So first is when we are taking the medicine that were prescribed for someone else. Second, taking a larger dose than you are supposed to. Third is the consumption of the medicine in a different way. For example, instead niya swallowing the tablets, you are crushing it and snort or inject it. Tapos, another is by using for another purpose. For example, gusto mo maging high or to feel good, to relax or ease pain. Other reasons why we are misusing or abusing prescription drugs is by the influence of peers, out of experimentations, tapos to prevent withdrawals, and some are to increase the alertness. Next is the OTC or the over-the-counter drugs. So these are the non-prescription medicines which may be purchased from a pharmacy or drugstore without written authorization coming from a doctor. So kabaliktaran hiya kung unprescriptive medicine kinahanglan hiyahin prescription from a doctor, and OTC mapapat mo hiya ha drugstore or ha pharmacy even without a written prescription. So the OTC are ginagamit hiya or used to for ang mga minor lang nga mga illness or short-term illnesses, like for example and coughs, colds, diarrhea, and etc. So, misusing drugs or drug abuse is dangerous. It can harm the body and brain and sometimes permanently nahiya. So, it can also hurt the people around you, including your families, friends, the kids, and for pregnant and kanan mga unborn babies pa, they are also affected by this misuse drugs or drug use. So it can also lead to addiction. So as siya may dakita sinisireng na prescription, kay there is a possibility of drug abuse. So,
thank you, Miss Artoza. So for the next lesson, may I introduce to you the pretty and bubbly lady from Julita Leyte, Jaya Calibo. She will be discussing what is self-medication syndrome, possible outcomes of self-medication syndrome, medical uses of drugs, and the common method of drug administration.
So the topic that I will going to discuss to you is all about the self-medication syndrome. So self-medication syndrome, it is a practice of taking medicines without proper consultation or proper prescription of drug from a medical doctor. So sometimes nakukuha naton it learnings hit self-medication through suggestions of others. Like, for example, ha aton mga relatives, may mga sinasuggest nila nga medicines para ha aton. It could be the neighbors. So, instead na magpakonsulta kita about it aton na inaabat na sakit, nasubay nala kita hit suggestion sa aton pamilya. So that is an example of self-medications. So there are possible outcomes of self-medications. So number one is adverse reaction towards the drug such as allergies which may be mild or severe. So of course, kapag may kita na intake na medisina tapos diri nga yung kita na ayon, so it could be lead to allergies. So it could be severe or mild. Number two is the possible non-response of the patient to the drug effectively due to incorrect drug usage. So, kapag improper aton pag-take han drugs, so pwede hiya diri tumalabha aton or pwede hiya maging malalait epekto ha aton lawas. So, number 4 is the possible number 3 is the possible drug toxicities such as nausea, vomiting, rashes, etc. So, pwede gyap kita magkamay adahin rashes, pwede gyap kita magsuka, throughhan aton gin-intake na medicines na diri nga naayon ha aton lawas or diri nga amo. So, number 4 is the possible habit forming characteristic due to periodic use of drugs even when such are no longer needed. So, pwede naton ini maging habit, pwede naton ini maging characteristic it pag-inom hin medisina bisan man diri naton kailangan or bisan man waray kita sakit na inaabat. So, therefore, we also have the medical uses of drugs. We have 10 medical uses of drugs. Number 1 is analgesics are drugs that relieve pain. However, they have produced the opposite effects on somebody who suffer from peptic ulcer or gastric irritation. Example, medical. So, medical sometimes take ini naton kapag maulot aton ulo. So, analgesic is diri pwede ha mga tawo nga nagsasuffer ng peptic ulcer or gastric irritation kay pwede to niya maging malala. Number 2 is the antibiotics are drugs that combat or control infectious organisms. Ingesting the same antibiotics for a long time can result in allergic reactions and cause resistance to drugs. Example, amoxicillin. Amoxicillin, dili mo talaga ya dali-dali nga mapapalit ha pharmacy or ha drugstore or diri mo hiya gihap dali-dali na makukuha mga clinic or health center. Kailangan talagahin prescription or consultation ani ha doktor ug sa kahini makapalit. So, number 3 is antipyretics, those that can lower body temperature or fever due to infection. Example, paracetamol. So, paracetamol ginagamit natin kapag mahiranat kita. Antipyretics is used to control or to lower the temperature. So, number 4 is the antihistamine, those that control or combat allergic reactions. Example, alerta. So, alerta, gitutumor naton kapag ginaatake kita hit aton allergies. Number 5 is contraceptives, drugs that prevent the meeting of egg cell and sperm cell or to prevent the ovary from releasing egg cells. Example, pills. So, pills ginagamit ng mga tao na nadiri pagburod. So, number 6 is decongestants, those that relieve congestions of nasal passages. Prolonged use of these decongestants might include nasal congestions upon withdrawal. Example, Nuzep. So, Nuzep is commonly ginagamit naton or gintetake naton kapag may mga sipon kita or maultot ulo or kung may hiranat gihapolso. Number 7 is expectorants, those that can ease the expulsions of mucus and phlegm from the lungs and throat. Example, Robitussin. Number 8 is the laxatives, those that stimulates defecations and encourage bowel movement. They should be not given to pregnant women and those suffering intestinal obstruction. Example, Dulcolax. So, Dulcolax, dere pwede mga burod because pwede makasama ha baby kapag natumar ito nit pregnant women. Number 9 is the sedatives and tranquilizers are those that can calm and quiet the nerves and relieve anxiety without causing depression and clouding of mind. Example is Zeleplon. Zeleplon is also used para mga may insomnia. So, gintutumar ito ng mga tao na ina-atake insomnia. Number 5 is vitamins. Those substances necessary for normal growth and development and proper functioning of the body. A person who eats balanced diet does not need supplements. So, vitamins para lahat dun mga malnourished or kulang in vitamins ha, lawas. So, that's all of my part.
So the common method of drug administration. So we have 5 methods of drug administration. The first one is the oral. This is the safest, most convenient, and economical route whenever possible. So when we say oral, it by means of through mouth. So the second one is injection. This form of drug administration offers a faster response than oral method. It makes use of needle or other device to deliver the drugs directly into the body tissue and blood circulation. So most of the drug users use injections so they can feel the effect of drugs faster. So it by means of through injection, most likely here in the arms, through the blood vessels. So the third one is inhalation. This route makes use of gaseous and volatile drugs, which are inhaled and absorbed rapidly through the mucus of the respiratory tract. So as we can see at the picture, there's a child, there's a use of plastic bag. So the next one is the topical. This refers to the application of drugs directly to a body site such as skin and mucous membrane. So as you can see, the drugs is applied through the skin. It's like a lotion. And the last one, the fifth one, the method of drug administration is the iontophoresis, the introduction of drugs into the deeper layers of the skin by the use of a special type of electric current for local effect. So it's what they pictures. Thank you to our 2 previous reporters. And now we moved on to lesson 3.2 entitled The Commonly Abused Drugs and Its Pharmacological Effects to the Users. So may I introduce to you our reporter, the hardworking and dream digger lady from Tanawan Leyte, Miss Andrea Luvino.
Marijuana. What is marijuana? It is a dried flowering or fruiting top of the plant Cannabis sativa, commonly known as Indian hemp. Usually looks like fine green tobacco. Street names: Mary Jane, Flower, Pampapogi, Brownies, Damo, Pot, and Joint or Dope. How it taken? Smoke in pipe or cigarettes or can be in food. Hashish is sometimes made into candy, sniff in powder form or mixed with honey for drinking. Pag intake daw ko no hito niya, based han akon kilala, may da ko no ingat nga kimpapaso, tas ang vapor niya amo ang hihinggokhan user. Tapos, may daluwat iton nakita ko ha movies nga, iging tutudtud diya, tas iging kakadahan ira juice or drinks, kasama na diretso pag inom. Physical effects, an immediate nga effect nga mafe-feelhan han user. Faster heartbeat and pulse rate and bloodshot eyes. It dries mouth and throat. Altered sense of time or disorientation, forgetfulness and inability to think. Impaired reflexes, coordination and concentration. Acute panic, anxiety reaction, extreme fear or losing control. It nga ni nga bagat diri ka maaram na kung ano na nananabo hanimo surroundings nga ni nga bagat muray ka na haimo tamang pag-iisip. Long-term effect liwat han marijuana, chest pain, irregular menstrual cycle para ha female, temporary loss of fertility for both sexes, premature babies and low birth weights, cancer, marijuana burnout, or ito nga ni nga sinisiring nga bagakahin na si semi-stroke na nag-animan function na nimo brain, nagtitikaluyan imo motor skills, diri na parehasan dati before ka pa mag-intake hiton nga marijuana. Sedative hypnotics. Sedative hypnotic drug chemical substance used to reduce tension and anxiety and induce calm or to induce sleep. Bagahin may ada iton hiya different effect. Kumbaga, depende ada hiya patawo kung ano epektuhay mo. Kay may ada ton iba nga nas nakakapakalma haira, may ada liwat bagat nagpapahyper haira. Such drugs exert a quieting or calming effect at low doses and sleep-inducing effect in larger doses. Sedative hypnotic drugs tend to depress the central nervous system, since this action can be obtained with other drugs such as opiates. The distinctive characteristic of sedative hypnotics is their selective ability to achieve their effects without affecting mood or reducing sensitivity to pain. One of the sedative hypnotics is alcohol. Is a term applied to members of a group of chemical compounds, specifically to ethyl alcohol or ethanol compound, which is the main ingredient of all alcoholic beverages. Trade names: beer, whiskey, gin, and brandy or wine. Effects in general: sedation, impairs mental and physical function, increases the risk of heart attack and stroke. Dangers: may lead to cancer of the esophagus, intestines, pancreas, thyroid, and breast. Addiction: those are the two sedative hypnotics, the alcohols and the barbiturates. Ininhiya nga duduha nga kuan nga sedative hypnotics. May different iton hira nga characteristics nga nakaka-affect ha tawo nga na-intake hiton. Iba-iba la, depende ha tawo nga na-intake. Kung small dosage lang iya gin-intake, mas lesser an effect nga mananabuhay iya. Tapos kung larger liwat, mas higher nga effect an mananabuhay iya. Tapos sedative hypnotic, asya ton hiya gin papagbawal gamiton hin masay nga always like han bioflu an mga normal lang nga mga medicine. Kay it can cause over sedation, memory impairment, poor motor coordination, and confusion. Kay as what I've said earlier, kay diba pag makatumar ka hiton, hanggat magiging kalmadon imo pakiramdam, magiging relax ka labisan ang surroundings, kailangan na mag-panic bagat sagad dayton. Though diri hira deadly, pero overusing hinin nga alcohol ngan kuan ngan barbiturates can lead to dangerous effects. Magkakaada lugod hin threat it imo kuan ba imo whole life, kay maadik ka man hiton pag ginamit. That's all.
Thank you, Miss Luvino. So we moved on to our next reporter. May I introduce to you our goofy yet pretty and sporty classmate from Harolete, Miss Danica Gariando. She will be discussing narcotics, which includes codeine, morphine, and heroin.
Good day, everyone. My assigned topic is all about narcotics. And now, let us define what is narcotics. Narcotics is also known as opioids. The term narcotics comes from the Greek word for stupor and originally referred to a variety of substances that dulled the senses and relieved pain. So, narcotic is a drug or other substance that affects mood or behavior and is consumed for non-medical purposes, especially one sold illegally. In medicine, narcotic is defined as a drug that relieves pain and induces drowsiness and insensibility. Though some people still refer to all drugs as narcotics. Today, narcotics refers to the opium derivatives, and their semi-synthetic substitute. A more current term for this drug with less uncertainty regarding its meaning is opioid. Narcotics are now called opioids. Example of this narcotic includes the illicit drug heroin and pharmaceutical drugs like oxycontin, Vicodin, codeine, morphine, methadone, and fentanyl. Be remember that narcotics is a substance that used to treat moderate to severe pain, and narcotics are the type of drugs that have the potential to be addictive. Why? Because of this addictive potential, this type of drug should be used according to a doctor's specific prescription. Any other type of use is considered abuse and can lead to addiction and other possibly life-threatening conditions. In narcotics, there are three types of drugs that we're going to be discussed, such as codeine, morphine, and heroin. So let us first discuss what is codeine, what is it, how it's taken, what is its effect in general, and what is the danger of this if we take this kind of drug. Codeine, what it is. Codeine is a component of opium and a derivative of morphine. It is 10 times less effective as morphine dose-wise. Physicians choose as an ideal antitussive, and it is found in a cough syrup. Codeine is an opioid pain reliever that is used to treat mild to moderately severe pain. It is also used usually in combination of other medication to reduce coughing. Codeine is available as a single ingredient product or in combination with acetaminophen or aspirin, and in some cough and cold medication. So the straight name of codeine is known as Skullboy. Now, how codeine is taken? It is taken orally in tablet form and can be also injected. So we have the effects of codeine in general. A. Analgesic and cough suppressant with very later sedation or accelerant or euphoric action. B. Dependence can be produced or partially supported, but large doses are required. Codeine is used to relieve mild to moderate pain. It belongs to the group of medicine called narcotics analgesic or pain medicine. This medicine acts on the central nervous system to relieve pain. Remember that codeine is an opioid pain relief medicine used for the short-term relief of mild to moderate pain. It is not usually recommended for the treatment of chronic or long-term pain. Codeine is only available for prescription from your doctor. And now we have the dangers of codeine if we take this kind of drug. So, dependence to the drug may occur in physical and psychological dependence. Psychological dependence is a term that describes the emotional or mental components of substance use disorder, such as strong cravings for the substance or behavior and difficulty thinking about anything else. And the next types of narcotic drugs is morphine. So what is morphine? Morphine is the principal active component of opium. It comes in a white crystalline powder, light porous cubes, or small white tablets. Morphine is also belongs to the group of medicine called narcotic analgesic or pain medicine. It acts also in the central nervous system to relieve pain. Morphine is a very strong painkiller, and morphine overdose occurs when a person intentionally or accidentally takes too much of this kind of medicine. And we have the straight name of morphine, known as M. Dreamer, Emma, Emcel, and Polbos. So, how morphine is taken? It taken any route, but mostly by intravenous injection. So, we have the effects in general of morphine. Its initial reaction is unpleasant to most people, but calming supersedes and depending on dose. May progress to coma and death from respiratory failure. And we have some effects of morphine, such as nausea, vomiting, constipation, lightheadedness, dizziness, drowsiness, increased sweating, or dry mouth may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. So, we have the dangers of morphine if we take this drug. A. Sensitivity to respiratory depressant affect until tolerance develop. B. Psychic and physical dependence. Tolerance develop quickly. So morphine may cause serious or life-threatening breathing problem, especially during the first 24 to 72 hours of your treatment if you are undergoing treatment. And anytime your dose is increased, your doctor will monitor you carefully during your treatment. So if you feel this kind of dangers or effect, tell your doctor if you have ever had slow breathing or asthma. And the last types of narcotic drugs is heroin. What it is? Heroin is chemically known as diacetylmorphine. It is a off-white or brown crystalline powder. Heroin is the white or brown powder or black. It is sticky. It can be mixed with water and injected with a needle. Heroin can also be smoked or snorted up the nose. All of these ways of taking heroin send it to the brain quickly, and this make it very addictive. So we have the straight name of heroin known as Blanco, Brown, Sugar, Kabayo, Kingkoy, Gamot, Matsako, Pulbos, Sapsap, and Tinig. So, how morphine taken? It is taken orally through inhalation, injection, or by smoking, referred as a chasing the dragon. However, intravenous injection is the most common method used. So, most users inject it into their veins, and that method is the most dangerous way to take it because it is easier to overdose and you can catch a disease from a dirty needle. And now, we have the effects in general if we take this kind of drug. A. Tracts and smallness of the pupil of the eye. B. Slowing down of physical activity and reflexes. Or we experience slurring of speech. C. Bluish discoloration of skin. Non-oxidation of blood. Dry and itching of skin. Or brittle nails. When we say brittle, our nails is easily or shatter easily. D. Dry mouth or excretion of body fluid slow down. Droppy eyelids. A. Lower blood pressure. Flush complexion. F. Lower skin temperature or cold skin. Cold skin we experience or we having a hypothermia. G. Decreased propulsive activity of intestines. So we experience constipation. And H. Lack of air to the lungs and excess sugar in system. So we experiencing lack of air to our lungs, and we having a hyperglycemia. And now we have the dangers of morphine. A. Dependence usually develop more rapidly. So we become more addictive if we take this kind of drug. B. Sensitivity to respiratory depressant effects. And C. Dependence liability is high. So that's all my report. Thank you, and to the next reporter.
Thank you, Miss Gariendo. Now we moved on to the next reporter. May I introduce to you our timid and cute classmate, Miss Maria Neca Ovejas. She will be discussing stimulants, which includes caffeine, cocaine, amphetamine, and methamphetamine.
Stimulants. Stimulants are a group of drugs that result in increased activity in the body, sometimes referred to as uppers. These drugs are frequently abused due to their performance enhancing and euphoric effects. Generally, those who abuse stimulants experience heightened energy levels and enhanced focus. Stimulants speed up mental and physical process, which can produce desirable effect in the short term by increasing levels of dopamine in the brain, while users may feel great due to the short-term effects of stimulants. Long-term abuse of these drugs can lead significant consequences, which is why it is so important for those who abuse the drugs to get help as quickly as possible. Stimulants are a class of drugs that speed up messages traveling between the brain and the body. They can make a person feel more awake, alert, confident, and energetic. Stimulants can be in the form of tablets, capsules, powders, and small chunky clear crystals, or a white or brownish crystal like powder with a strong smell and bitter taste. Illicit stimulants are usually snorted, swallowed, smoked, or injected. Prescribed stimulants are usually taken orally, and how long the effect lasts differs depending on the type. Caffeine is a central nervous system stimulant and the most commonly consumed legal psychoactive substance. It has a wide range of effects of most people and is considered safe in limited amounts. What is it? A slightly bitter alkaloid or metal xanthine in coffee, cola, or tea, cocoa, soft drinks, and over-the-counter medications. Effects in general. First is mental alertness and general sense of well-being. Second, acid producing in the stomach. Third, elevated heartbeat and irregularities in heartbeat. Fourth, psychological and physical dependence. Danger. Causes osteoporosis, gastritis, heartburn, ulcer, and cardiac arrest. It also alters brain, electrical activity, and dangerous to diabetics. Cocaine comes from the leaves of coca bush, Erythrocilum coca, native to South America. The leaf extract is processed to produce three different forms of cocaine. First, cocaine hydrochloride is most commonly snorted. It can also be injected and rubbed into the gums. Second is pre-vase, and third is crack cocaine, are usually smoked. What is it? It is an alkaloid extracted from the leaves of coca plant. In its pure form, cocaine is white. It is made up of shiny look-like crystalline snow. In powder form, it is odorless and bitter. Street names are coke, crack, gold dust, heaven dust, and speedballs. How taken? First, orally, by mixing cocaine with a liquid or semi-liquid placed in a capsule or swallowed. Second, application by applying cocaine directly on the gums, underneath the tongue, or side of eyelid. To prevent premature Some males apply it directly to the penis, females under the vagina. Next is injection, by directly injecting into the veins. Next is sniffing, by inhaling into the nostrils. Physical effects. First is acceleration of pulse rate, increasing of blood pressure and quickening respiration rate. B is dilation and sluggish reaction of eyes, pupils, slurred speech. C is complete loss of appetite, intense feeling of thirst, dryness of the mouth. D is feeling of hyperactiveness, talkativeness, and forgetfulness. E. Insomnia or the inability, need or desire to sleep, sense of smell intensifies. F. Constipation, fatigue, and cramps, nausea, vomiting. Last is perspiration on forehead and neck tracts, the needle marks. Psychological effects. A. No feelings of inhibition, users tends to commit criminal and bizarre sexual acts. B. The desire for sex and varying sexual activities increases. C. Restlessness, irritability, and anxiety, a feeling of well-being. D. Feeling or paranoia. Users becomes very suspicious and untrusting. A. Hallucination or intense daydreams, feeling that insects, snakes, or lice are crawling in the user's body or under his skin, which causes him to scratch his body constantly. F. Extreme depression may result to loss of interest in life and suicidal or morbid tendency. G. Causes psychological dependence. It become extremely habit-forming drugs. Dangers. Low doses may create psychological problems. Overdose may cause delirium, convulsions, respiratory failures, or death. B. Repeated use of cocaine leads to addiction. Regular intake of high doses of cocaine may cause paranoia or may lead to cocaine psychosis or hallucination of touch, sight, and taste. C. Injecting cocaine with unsterilized equipment can cause AIDS, hepatitis, or other infections. Note: effects begin a few minutes, peak in 15 to 20 minutes, and disappear within an hour. Amphetamines are psychostimulant drugs, which means they speed up the messages traveling between the brain and the body. Amphetamine is a powerful stimulator of the central nervous system. It is used to treat some medical conditions, but it is also highly addictive with a history of abuse. Using amphetamine under prescription stimulant can be safe and effective. It can be legal or illegal. They are legal when they are prescribed by a doctor and used to treat health problems such as obesity, narcolepsy, or attention deficit hyperactivity disorder or ADHD. What is it? A stimulant prescribed by the physicians chiefly to reduce appetite and to relieve minor cases of mental depression or to comfort fatigue and sleepiness. Often used to promote wakefulness and or increase energy. Street names: eye opener, lead poppers, pip pills, uppers. Have taken orally as a tablet or capsule, or abusers may resort to intravenous injection. Physical effects. Normal dose produce wakefulness, increased alertness, and a feeling of increased initiative. Next is restlessness, palpitation, dry mouth, hypertension, abdominal cramps, circulatory collapse, and cardiac arrhythmias. C. Nausea, vomiting, convulsion, coma or death, and insomnia. Psychological effects. First is panic reaction and paranoid ideation, anxiety, delirium, dangers, violent bizarre behavior, strong dependence on pills increase the probability of overdose.
Thank you, Miss Obejas. So for the continuation of her report about stimulants, we have our next reporter. May I introduce to you our cheerful and lovely classmate, Miss Maria Chuzani Silvana. She will be discussing methamphetamine, shabu, and ecstasy.
Is methamphetamine. Methamphetamine is a stimulant closely related to amphetamine or ephedrine. Methamphetamine is a powerful, highly addictive stimulant that affects the central nervous system, a type of the drug that lets people stay awake and do continuous activity with less need for sleep. So, methamphetamine is by straight names which is shaha, speed, and splash. It is taken by orally or intravenous. Methamphetamine physical effect. A. Normal dose produce wakefulness, increased alertness, and a feeling of increased initiative. So, because of taking this drug, the user will become not able to sleep and they become more energy to do something. In short, people who use this drug, they become more hyper. B is restlessness, palpitation, dry mouth, hypertension, abdominal cramps, circulatory collapse, and cardiac arrhythmias. C is nausea, vomiting, convulsion, coma, or death, insomnia. Psychological adverse reaction of methamphetamine. A is anxiety reaction. Individual becomes fearful and tremulous with concern about his physical being. B is methamphetamine psychosis. Individual misinterprets other action, hallucinates, and become unrealistic suspicion. Yes, because of this drug, people experience hallucination. C is exhaustion syndrome. Individual feels intense feeling of fatigue and need to sleep following the stimulant on face. D is prolonged depression. So, because of using methamphetamine, the user will experience depression, which is it leads to commit suicide. E. Prolonged hallucinosis. Individual continues to hallucinate after drug has been metabolized. Danger. Excessive psychotoxic effects may lead to death. B. Causes cardiovascular anomalies leading to jaundice and microcephaly among babies. Shabu. Shabu is a white odorless crystal or crystalline powder with a bitter, numbing taste. Chemically, it is known as methamphetamine hydrochloride. Shabu is taken by ingestion, inhalation, injection, and smoke with a small pipe from a heated aluminum foil. So, shabu is a physical effect to the user. A is chest pain, irregularity of heartbeat, and hypertension. B is convulsion and death from cardiac arrest. C is severe irritation of nasal passage, loss of appetite, and inability to sleep. So, person who take this drug, they don't have a interest to eat and even to sleep because taking this drug, our mind become more active and hype to do something. Psychological effect of shabu. A. Irritability, irrational behavior, talkativeness, and loss of self-control. So, people who use or take this drug, they become active on talking. They cannot control his or herself to do a bad things. So, B is anxiety reaction. Individual becomes fearful and tremulous with concern about his physical being. C is psychiatric consequences which can lead to manifestation of a full-blown psychosis similar to schizophrenia characterized by the presence of paranoid delusion and audio-visual hallucination. D is psychotic reaction. Individual misinterprets other action, hallucinate, and become unrealistic suspicious. F is difficulty in concentrating or in remembering things, loss of interest in sex, and ambition. Shabu addiction can cause permanent changes in the brain of the user. The downward spiral abuser can still be stopped with the help of rehabilitation. F. Ecstasy. What it is? Ecstasy is an amphetamine type stimulant MDMA. It is a white, yellow, or brown in color with a bitter taste and comes in the form of tablet, capsules, or powder. Ecstasy is popular to the teens and young adults who go to club, concert, and rave parties. So users think that drug will make them feel good and keep them going for days without risk. But people who use ecstasy don't realize how dangerous this drug is. Ecstasy has become one of the most common illegal drugs sold on the streets. In the last few years, ecstasy has sent many people to emergency room because of its dangerous side effects. Street names of ecstasy: it ecstasy, Adam, essence, herbals, or E. How taken? Ecstasy can be swallow or inhalation. Ecstasy effect in general. A. Exaggerate emotion and make heart rate and blood pressure hike up. B. Dry mouth and throat. C. Delayed pupil of the eye. D. Stiffen arm, legs, and jaw. And the last one is E. Cause faintness, chills, sweating, and nausea. So, if the person take ecstasy, his or her body can dangerously overheat during dancing or other physical activities, which can lead to muscle breakdown, kidney, liver, and heart damage, and even death. Ecstasy use can cause seizure, brain swelling, possible brain damage, and even death.
So that's all for the lessons under Module 3 Drug Education. So we have discussed what is drugs, the two forms of drugs, importance of drugs, the difference between prescriptive drugs and over the counter drugs, what is self medication syndrome, possible outcomes of self medication syndromes, medical uses of drugs, common method of drug administration, the commonly abused drugs, and its pharmacological effects to its users, which includes hallucinogens, LCD or lysergic acid diethylamide, the marijuana, sedative hypnotics, which includes alcohol and barbiturates, the narcotics, which includes codeine, morphine, and heroin, and the stimulants, which includes caffeine, cocaine, amphetamine, methamphetamine, shabu, and ecstasy. All in all, drugs has its own advantages and disadvantages. It can be a lifesaver, but it can also be a life taker. So when you use drugs in order to cure illnesses, make sure that you will use the right amount of it because the abuse of drugs can leads you to death. So that's all for our report. Thank you for listening.